Welcome back. We are on Chapter 25, Poisoning and Overdose Emergencies. In this section, we're going to talk about poisoning and alcohol and substance abuse. This first section will talk about poisonings. Poisoning is any substance that can harm the body. The harm it can cause can result in a medical emergency. So safety must be your first priority when treating a patient with a poisoning. Common poisonings can be medications, petroleum products, cosmetics, pesticides, plants, and food. Effects of a poisoning. Harm to body based on nature of the poison, its concentration, route of entry, patient's age, weight, and their health. It can cause damage to skin and tissues from contact, suffocation, and localized or systemic damage to the body systems. Poisonings classified by route. Ingested, which is swallowed. Inhaled, which is breathed in. Absorbed, which is through the unbroken skin. And an injection, which is injected through the skin. So they are classified into 4 types: ingested, inhaled, absorbed, or injected. On your pediatric note, EMT's own home and squad building should be child-proofed against any poisonings. Shared poisoning prevention information with members of the public during school visits and community outreach programs are highly recommended. So remember that the classifications of poisonings are by routes of entry, and those 4 are ingested, inhaled, absorbed, or injected. With ingested poisonings, with a child, they may accidentally eat or drink a toxic substance. With the adult, it is often an accidental or it could be a deliberate medication overdose. During your patient assessment, you want to ask what substance was involved. Get the exact spelling and transport the patient to the hospital. You also want to know, when did the exposure occur? Is it a quick-acting poison which requires faster treatment? And ED personnel need to know for appropriate testing and treatment. So the sooner you can get the ED that information of what it is, the better and the quicker and more appropriate testing and treatment they'll be able to provide. So assessment of a poisoned patient must include determining the nature and the amount of the substance, the time and the length of the exposure, and the possible interventions prior to your arrival of EMS. What did that patient do before you got there? You also want to ask how much was ingested. Estimate missing pills by looking at the prescription label. On the prescription label, it will always tell you the date that it was filled and how many pills should be in there. It will then also tell you how many pills should be taken per day. So if you take the day that they got it times how many they received and divide that out by how many they should take per day, you should know how many pills should be in there. So if they got their prescription refilled yesterday and it had 30 pills in there and they're supposed to take 1 a day and they have no pills in there today, so yesterday they got it filled, today they have nothing, you know that they potentially took 29 or at least 30 of, potentially 30 of those pills. And then over how long of a period did the ingestion occur? So treatments might vary. So what medication was taken for the first time? And then was the medication being taken chronically? So over a long period of time. Your body does react differently if it was taken for the first time versus being chronically taken or taken over a period of time. You also want to know what interventions have been taken. Did they do any home remedies or treatment indicated on the label? What is the patient's estimated weight? Treatment is related to weight. So children experience greater effects because of the smaller the size they are. You also want to know what effects has the patient experienced. Did they have nausea, vomiting, altered mental status, abdominal pain, diarrhea, chemical burns around the mouth, and unusual breath odors? With food poisoning, it can be caused by improperly handled or prepared food. Symptoms can be nausea, vomiting, abdominal cramps, diarrhea, and fever. You can prevent it by washing hands and surfaces that touch raw meat. Activated charcoal works through absorption, allowing substances to attach to its surface, but it is not an antidote. It prevents or reduces the amount of poisoning absorbed by the body. Many poisonings, but not all, are absorbed by activated charcoal. Medical direction will determine whether the use of the substance is appropriate or not. Contraindications of activated charcoal is that the patient can't swallow, if they have an altered mental status, if they ingested any acids or alkalis, or if the patient swallowed gasoline. So what's the difference between activated charcoal versus the syrup of ipecac? So traditionally, syrup of ipecac was preferred treatment for poisonings. It induced vomiting in most patients with just one dose. However, it has the potential to make patients aspirate and only removes less than 1/3 of the stomach contents. So that's where activated charcoal then came in. Dilution. So adult patients should drink 1 to 2 glasses of water or milk. A child should drink 1/2 to 1 full glass of water or milk. Water may actually slow the absorption, but milk may soothe the stomach upset. It is frequently advised for patients who, as determined by medical direction, do not need transport. So your patient care consists of detecting and treating life-threatening problems. You're going to perform a secondary assessment, assess the baseline vitals, consult medical direction or poison control, transport with substance information, and perform the reassessment en route. Next, we'll talk about antidotes. So it is thought that the substance will neutralize the poison or its effects. There's very few genuine antidotes that actually exist. So naloxone directly reverses narcotic depressant effects on the level of consciousness and respiratory drive. Next is acetaminophen poisoning. It's a common cause of overdose. Its toxic efforts do not appear right away. So within the first 4 to 12 hours, they'll have loss of appetite, nausea, and vomiting. In 1 to 2 days, they might have right upper quadrant pain and jaundice. So the antidote should be given within that first 12 hours. However, you may not know, or you may not even be called until day 1, 2, or even later. Your pre-hospital assessment and management. So you want to suspect acetaminophen poisoning with any overdose. You're going to search medicine cabinets and garbage cans for any empty pill bottles. You might find the empty pill bottles on the dresser or a nightstand or thrown across the bedroom or thrown across the living room. Deal with the apparent life threats first, and then treatment can actually be instituted at the hospital. But always look around for any empty pill bottles or anything that would suspect that they had an overdose. As always, you always want to take standard precautions first. Quickly gather any information on the substance, the timeline, the amount, the symptoms, and then any interventions. En route, you want to contact medical direction either from the scene or while en route to the hospital. The patient's condition and local protocol will dictate your next action. If directed, you want to administer activated charcoal. If available, it may be tolerated if given in a container with a cover and lid with a straw in it. However, I know most ambulances don't just have a supply of straws. But remember that activated charcoal is contraindicated with some substances. Medical direction may order that you dilute the substance with water or milk if activated charcoal is not indicated. Then, as always, you want to be prepared for vomiting and keep suction nearby. Save any vomit for possible analysis at the hospital. Here's some things to think about. Think about, is your own home safe? Is it safe for a small child? Are there potential poisonings within 3 feet of the floor or behind unlocked doors? Are there any household cleaners that look like juices or drinks familiar to children? Can flavored children's medication be mistaken for candy? And what sense does a small child typically use to identify things? So many EMS agencies have community education programs that teach ways to childproof a home. So this is something that you may come in contact with when you start working for an agency, is that they might have you or require you to be involved in community education. Next is inhaled poisoning. So common types are carbon monoxide. That's that deadly killer that we'll talk about if we haven't hit too much on it, but we will. So carbon monoxide, especially more prevalent in the wintertime in fish houses or enclosed buildings where they have heaters going, NIPCO heaters and such. Chlorine gas, ammonia, agricultural chemicals and pesticides, and carbon dioxide. You always want to be sure that your scene is safe. Approach the scene with caution. Always have protective clothing, and self-contained breathing apparatuses may be required. And if not trained or equipped, call for additional resources. You want to find out what substance was involved and get the exact name. When did that exposure occur? How long did the exposure occur? What interventions has anyone taken? Did somebody remove the patient? Did somebody ventilate the area? What effect is the patient experiencing? So there's lots of different things you need to ask and know and understand why you're asking these. Because every time that they answer a question, it could push you to something different. Carbon monoxide, that is that colorless, odorless, tasteless gas. It can be caused by improper venting of wood-burning stoves, furnaces, or generators. Common causes of death during natural disasters and power outages. Signs and symptoms of poisoning can be headache, especially a band around the head, dizziness, breathing difficulty, nausea, cyanosis, and altered mental status. In severe cases, you may have an unconscious patient. You should suspect carbon monoxide poisoning whenever you are treating a patient with a vague flu-like symptoms who have been in an enclosed area, like a garage or a fish house or a Quonset building or something where they need heat and it's not well ventilated. This is especially true when a group of people in the same area have the similar symptoms. It's always a good idea to have a CO monitor. There are special monitors that are needed to detect the presence of carbon monoxide in the environment. Treatment for carbon monoxide poisonings. So first thing, patient may begin to feel better shortly after being removed from that dangerous environment. You want to administer 100% oxygen and transport to the hospital immediately. It takes time to wash out the CO from the bloodstream, so high flow oxygen continually on the way into the hospital. Call ALS if their CO levels are above 10, and consider helicopter if it's much higher. With patient care, you want to move the patient from any unsafe environment using trained and equipped personnel. You want to detect and treat immediate life-threatening problems in your primary assessment. Perform your secondary assessment and obtain vital signs. Next, you want to administer high concentration of oxygen and transport with all containers, bottles, and labels that you find. And then perform your reassessment en route. Next, we're going to talk about smoke inhalation. Smoke inhalation is associated with thermal burns as well as effects of irritants and chemical poisoning within the smoke. So the substance can actually burn the skin, irritate the eyes, and injure the airway. And that is then going to progress to respiratory or cardiac arrest. Signs and symptoms of smoke inhalation are going to be difficulty breathing, coughing, smoky or chemical smell on the breath, black or carbon residue in the mouth, nose, or sputum, and singed nasal hairs. Remember, anytime you have smoke inhalation and there's that black residue in the mouth, the nose, the sputum, the singed hairs, whichever, you need to get ALS coming immediately. Okay, if you have the ability to get a helicopter, get them rolling right away. This patient is in critical condition. So for your treatment, you want to move that patient to a safe area, assess the patient, maintain an airway, provide high concentration of oxygen, and transport immediately. Again, calling ALS, going, if you're a transporting service, getting them en route to maybe intercept with ALS, get a helicopter, whatever it is, but again, they are in critical condition. Next is detergent suicides. So this is a method of suicide that was started in Japan and it's becoming more common in the United States. So again, always being sure that your scene is safe. And even though there's a patient unresponsive inside of a vehicle, be very, very cautious before you just go and open that door, okay? So what detergent suicide is made up of is it's a mix of two very easily obtained chemicals to release toxic hydrogen sulfide gas. A lot of the times it's going to be a strong household cleaner and a source of sulfur, which is typically you're going to find in the pesticides, okay? So we'll get back to that. So it's commonly released inside of an enclosed space, typically a car, okay? So you have the source of acid, which is typically your strong household cleaner. Then you have a source of sulfur, which is oftentimes a pesticide. When you take those two and mix them together, they will quickly release a significant amount of toxic hydrogen sulfide gas. This is when the victims will often leave a note warning others of this hazardous gas. So it does not take very long for these people to succumb to the toxic chemicals, okay? So don't go up to a car and just open up the door because those toxic hazards could overcome you as the responder. So this is when you're calling in your additional resources. You need the fire department in there to be able to come in and open that vehicle and get that patient out and then clear the area. You as an EMT, EMR, whatever, should not be doing that unless you have the appropriate PPE and respiratory. I totally lost my train of thought. Respiratory, you know what I'm talking about. Like the fire department. Sorry. With the detergent suicides, scene safety is key. You have exposure to fumes, which may injure the EMS personnel. The warning note may be left on the vehicle, but this is not always assured. So don't always assume. So when you do go up to the car, don't open the door and put your face in it right away. You want to open the door, stand back, and if you see any fumes or you see, a fog in there, call the fire department, okay? You may need to treat first as a hazmat scene, okay? So warning signs to look for include a small enclosed space, typically a car. If they have tape sealing the windows and doors, good indication. Any kind of sign or note warning people to not approach should be taken very seriously. You need to call the appropriate agency to open the space and remove the body. Do not become another casualty. And when I say remove the body, that's exactly what it is. A lot of the times these are pass away very soon after these two chemicals mix. So you're no longer going to try to do life-saving measures. It's a body recovery essentially. Next one is going to be absorbed poisons. This can be absorbed through the skin. It may or may not cause skin damage. And then the patient may require decontamination prior to treatment. So if they do have any absorbed poisons on their body, say they have 5 gallons of bleach dumped all over their body, that is considered a poison, okay? So they have to be decontaminated before you put them into your truck. There's other ones that could be like powdered substance. If you have powdered substance, you need to wipe off as much of the powder as you possibly can. Now, taking your safety into consideration, and you have the appropriate respiratory gear on to take care of that, okay? Don't let your body get involved in getting that stuff on your skin. So you need to get the appropriate decontamination gear on before you start this process. So people think that, in EMS, we got to run and we got to get in there and do stuff right now. However, in these situations, you're not. It's not a fast process. You need to make sure that you have your suit on, your hazmat suit on. You need to make sure that your respiratory is taken care of. You need to duct tape around your wrists, your ankles, anywhere where there could be exposed skin. So it is not a fast process when you're talking about this. Next is your patient assessment. So you want to detect and treat any life-threatening problems in that primary assessment. Perform the secondary assessment and obtain vital signs. If there's any powder on that patient, you want to remove the powder by brushing it off. You want to get as much of that powder off of them as possible, and then start irrigating with clean water for at least 20 minutes and during transport. The reason for this is because for brushing off the powder first before just cleaning them with water is because sometimes powders don't actually start a reaction until it's mixed with water. So you just got to know what chemical you are working with and so forth. Then you want to transport with all containers, bottles, SDSs, and labels from that substance, and then perform reassessment en route. The next one we'll talk about is injected poisonings. These are most common, known as the illicit drugs that are injected with a needle or venom of the snake or insects. Next is poison control centers. These are an excellent resource for you. They have information on poisonings, signs and symptoms, and your treatments that you should do. You want to also follow your local protocols for contact procedures. So remember that poison control centers offer you a vast network of poison-related resources that may aid in that patient care. So don't be afraid to call them. Have that number readily available, put it in your phone, whatever the case may be, because you never know when you're going to use it. And it might not always be at work, it might be at home as well. In this next section, we're going to talk about alcohol and substance abuse. You always want to be sure that you know and understand that alcohol and substance abuse are both safety threats to the emergency responders. Okay, so you want to assure good safety habits when dealing with these types of patients. If you know and understand mental health, this is going to help you huge when you're dealing with these patients. We'll discuss different things about how the assessment with the patient with an altered mental status, especially when it has to do with alcohol and substance abuse, will come into play. I highly recommend the department that you work for or whomever is getting in contact with your local law enforcement for either one, educational resources on what's going on in your area, or different things that different substance abuses that they're seeing at that time, and they change often. So just be sure that you check into that. And then we will also relate substance abuse to the discussion of poisonings. So, you know, substance and alcohol abuse are potentially an overdose, and they are the same as would be a poisoning. So think about that. All right, so many patients have conditions that are caused by either directly or indirectly by alcohol or substance abuse. Abuse of alcohol and other drugs crosses all geographic and economic boundaries. There's not just one area of people that have alcohol and substance abuse. It can be anybody from the poorest of the poor to the richest of the rich. So when you're going out to these homes, it does not matter what these people live in. It does not matter the status of their lifestyles or whatever. It does not matter. It can be the very poor or the very rich or everybody in between. So just keep that in the back of your mind that it's not, you cannot be stereotypical, because it does not work. Okay, it's across every walk of life. All right, next we're going to talk about alcohol abuse. So it's a potent drug that affects the central nervous system. Emergencies may result from recent consumption or years of abuse. Treating the patients with the same respect and dignity as others is very, very important. Okay, you don't know why they're in that situation. Abuse can lead to or worsen other medical conditions. So if you are a diabetic and you are heavily drinking, you may have more issues than just having alcohol on board. It could be messing up with your blood sugars, maybe you're a cardiovascular patient, and it's messing with your heart functions and so forth. So abuse can lead to many other conditions, medical conditions that are going to just enhance it. So keep that in mind as well. Okay, so alcohol is often consumed with other drugs, which can result in a serious medical emergency. Any impaired patients can be irrational or aggressive. You want to contact law enforcement if you have a feel like your safety is a concern. You also want to think about how alcohol might impact the patient's ability to give informed consent or to refuse care. So if you're looking at a patient who is intoxicated, are they really in the right state of mind to refuse care? The answer is no. If they're intoxicated from alcohol or drugs, they're not in the right state of mind to give that consent to be able to refuse. So this is when you either need to get family involved, to encourage them to go to the hospital, or if they're comfortable with signing them off, they can. However, you need to be extremely clear with them and very concise, and you need to document exactly what you tell them, that if you choose not to go into the hospital and this gets worse, you could die. And use the word die. But how might you deal with a patient who's refusing care but is obviously intoxicated? Those ones, again, getting law enforcement involved, getting family involved, this is going to be your best option. When you're doing your patient assessment, you want to make sure that you realize that many medical conditions mimic alcohol intoxication. Intoxicated patients may also have medical problems. So all patients should receive a full assessment regardless of the suspicion of intoxication. So alcohol abuse may be a primary problem or a problem that compounds other illnesses or injuries. So don't get tunnel vision and actually do your assessment. Signs and symptoms of alcohol abuse can be alcohol odor on the breath or the clothing, swaying or unsteady gait on their feet, slurred or rambling speech, flushed or complaining of being warm, nausea, vomiting, poor coordination, and slow reaction time. They may complain of blurred vision, confusion, hallucinations, visual or auditory, lack of memory or blacking out, and altered mental status. Then there's alcohol withdrawal. So this is when somebody decides that they're going to just abruptly stop drinking. But the problem with that is it may cause some alcoholics to suffer from delirium tremens, or what's also called DTs. It can be serious, resulting in tremors, hallucinations, and even seizures. So with alcohol withdrawal, it can cause a serious physiological reaction, and in some cases, it could become fatal. Some other signs and symptoms you might see from alcohol withdrawal are confusion and restlessness, unusual behavior, hallucinations, gross tremors of the hands, profuse sweating, seizures, hypertension, and tachycardia. Vomiting is going to be very common, so you want to use standard precautions, which are essential. Stay alert for airway and respiratory problems, assess for trauma, and be alert in any mental status changes. When it comes to patient care, you want to be sure that you're monitoring their vital signs. Treat for shock, protect the airway from self-injury, stay alert for seizures, and transport the patient to a medical facility. Next, we're going to talk about substance abuse. So any chemical substance taken for any other therapeutic or medical reasons, including opioids, uppers, downers, hallucinogens, and volatile chemicals. So we'll start out with opioids. So opioids are drugs that bind to opioid receptors in the body, sometimes called narcotics. So these drugs have a depressant effect on the body and causes an intense state of relaxation and feeling of well-being. So opioids can be prescribed for pain, which is going to be your codeine, your OxyContin, and your Percocet. But then there's also found where there is illegal drugs, which is heroin. So many people who are addicted to heroin began using opioid medications for pain relief. This then leads to addiction. Heroin is an illegal substance that can be injected or snorted, and it is sometimes mixed with other substance called fentanyl, which is more potent than the actual heroin itself. These often result in rapid and devastating overdoses. So narcotic overdoses are generally characterized by 3 different signs. So it can be the coma or depressed level of consciousness. They can have pinpoint pupils and respiratory depression, which is slowing and shallowing of the respirations. Together, these sometimes are referred to as the opioid triad. Okay, so with this anytime you're talking about opioids, you have to understand that if they think that they're getting just heroin, that might not always be the case. And then that's when you can use Narcan. However, if the heroin is mixed with meth, the Narcan will work on the heroin, but it will not work on the meth. So just know that just because you give them Narcan does not mean that they'll come out of that state of relaxation or overdose. Signs and symptoms of opioids is reduced rate of pulse and rate and depth of breathing. They'll have lowered skin temperature, pinpoint pupils. Their muscles will be relaxed. They'll have profuse sweating. They could be sleepy and even into a coma. Next are the uppers. So the uppers are stimulants that affect the nervous system and excite the user. So many abusers use these drugs in an attempt to relieve fatigue or to create the feeling of well-being. So examples are caffeine. So how many of us drink a cup of coffee or two in the morning or drink a caffeinated pop, throughout the day? A lot of us do that. Okay, those are the uppers. There's also in the uppers category is methamphetamines, Ritalin, and cocaine. So cocaine may be snorted, smoked, or injected. Other stimulants are frequently taken are typically in a pill form. It's also included in this category is the so-called bath salts, they call them, which are synthetic drugs that have very potent stimulant effects and sometimes causes hallucinations. Signs and symptoms of uppers can be excitement or restlessness, increased pulse and breathing rates, rapid speech, dry mouth, dilated pupils, sweating, and no sleep for a long period of time, possibly even days. All right, the next one we're going to talk about is downers. So downers has a depressant effect on the central nervous system. This type of drug may be used as a relaxing agent, sleeping pill, or a tranquilizer. Benzodiazepines are also an example. So Valium, which is also known as diazepam, and Xanax, which is also known as alprazolam, are commonly abused medications. These are typically found in a pill or capsule form. Another example of a downer that you might encounter on EMS calls is Rohypnol, which is also considered a roofie. They have effects that include sedation, confusion, and even blackouts. The problem with this drug is it is colorless, odorless, and tasteless, and this is what they typically will find that have been slipped into people's drinks and has been known as it's been called the date rape drug. Another one that you might know of or have heard of is called the GHB, which is also known as the Georgia Homeboy or even Goop. So in addition to depressing the central nervous system, it produces a sense of euphoria and sometimes even hallucinations. But it has caused respiratory distress or depression so severe that patients have required assisted ventilations, even though some of them were actually still breathing. But it's just that their respiration drive went so incredibly low that you had to breathe for them or assist with their ventilations. All right, the other one that we're going to talk about is hallucinogens, such as LSD, PCP, and certain types of mushrooms are mind-affecting drugs that can actually act on the nervous system to produce an intense state of excitement or distortion of the user's perception. So this class of drugs has very few legal uses, so 99% of the time it's going to be an illegal drug use. They're typically eaten or dissolved in the mouth and absorbed through that mucous membrane. Other hallucinogens can be ecstasy, which is also known as XTC, X, or MDMA. This hallucinogen also has the stimulant properties of uppers and is very popular in the club scenes. And the last one is going to be the volatile chemicals, which is produced vapors that can be inhaled. They give an initial rush, and then they act as a depressant on the central nervous system. So cleaning fluid, glue, model cement, or correction fluids used to correct ink-based errors are commonly abused volatile chemicals. Okay. Signs and symptoms can be dazed, loss of contact with reality. They may develop into a coma, swollen membranes in the nose or the mouth, have a funny or numb feeling or tingling inside the head, and then changes in the heart rate. So here you will see that the volatile chemicals produce vapors. This is what they were talking about with that it can be inhaled. So the methods of inhaling include the huffing or the bagging. And this is what they do. Typically, these people like the metallic paint, so like the gold or the silver metallic paints. They spray it into the bag, they put the bag around them, and then they huff it. A lot of the times what you're going to end up seeing, not necessarily in rural so much, but in metro areas, you're going to see where people are walking around with gold and silver, like goatee mustache looking things around their mouth, because that's what they're doing, is they're huffing or bagging those paints. When you're doing your patient assessment, it might be difficult. Signs and symptoms vary from patient to patient. Patients may have taken more than one type of drug, so you never know what you have coming down, when you're going into the scene. Signs and symptoms are very similar to other medical emergencies. So what you want to do is you want to begin by asking if the patient has taken any medications, and then ask about any additional drugs. So you should always use a thorough patient assessment and clues to gain from the scene. So bystanders, the patient, let them help you. The other thing is scanning the scene. I can't stress enough how scanning the scene is going to keep you safe in the long run. They might have withdrawals or drug withdrawals, so they might have shaking, anxiety, nausea, confusion, and irritability, hallucinations, visual or auditory, profuse sweating, and increased pulse or breathing rates. So if you see any of these, they may be having a drug withdrawal. All right, so during patient care, you want to perform your primary assessment like always, but you want to be alert for airway problems and respiratory distress. Provide them oxygen and assisted ventilations as needed. You want to administer naloxone intranasally, treat for shock, talk to the patient to keep them calm and cooperative, and then perform your physical exam. One other thing that I want to mention, anytime that you're dealing with somebody that is uncooperative, it might not be a bad idea for you to just step back and let somebody else take over. So if you're, say, with a crew of 3 people, and you walk into the home and you're talking to the patient and they're swearing at you and arguing with you and they don't want anything to do with you, I don't care what level you're at. I don't care if you're an EMT, EMR, paramedic, nurse, doctor, doesn't matter. Sometimes what you need to do is realize that this patient is just not having it with you. So step back, okay? Let somebody else go in there and ask the questions, because they might have seen you as a threat because you were the first one that walked through that door. So step back, let somebody else take over and see if you can get somewhere with them. Next, you're going to look for evidence of injection sites or track marks. Track marks, years ago they used to always say look in the AC. So look, where your arm bends, where by your elbow, that's your AC. That's a lot of the times where people would find track marks. That's not the case anymore. They're finding them in between the fingers, in between the toes, and behind the ears. So just be careful and always do a full, thorough assessment. You want to protect your patient from any self-injury and transport as soon as possible. Consult medical direction according to your local protocols, and then perform reassessment and monitoring vital signs. Always continue to reassure the patient throughout all phases of care. So this is what you might see. These are the needle tracks on a patient's arm, indicating a history of injected drug use. All right, let's go over the chapter review. In a poisoned patient, perform a primary assessment and immediately treat life-threatening problems. Ensure an open airway. Administer high concentration oxygen if the poison was inhaled or injected. Next, you want to perform a secondary assessment, including the baseline vital signs. Find out if the poison was ingested, inhaled, absorbed, or injected. or what substance was involved, how much poison was taken in it, and when and over how long of a period exposure took place. And then what interventions others have already done and what effects did that have on the patient's experience. You want to be sure to consult medical direction. As directed, you want to administer activated charcoal or water or milk for ingested poisonings. Remove the patient who has inhaled a poison from the environment and administer high concentration oxygen and remove the poisons from the skin by brushing them off or diluting them. Transport the patient with all containers, bottles, and labels from the substance. Reassess the patient en route and carefully document all information about poisoning interventions and patient responses. Safety is always the first concern when dealing with a poisoning or substance abuse patient. Poisonings are generally classified by route of exposure. Effects vary greatly, depending on the type of poison and the method of entrance into the body. Remember, EMTs must use thorough assessment, including scene clues, to help identify the nature and the severity of the poisoning. Poison control centers offer a wealth of resources to assist in assessment and treatment of poisoning patients. Alcohol is a common underlying issue with patients. In some patients, it may be the most significant problem. The effects of substance abuse can vary greatly, based on the type of substance. Determining the type of drug ingested can shed light on the effects to come. Questions to consider. What are potentially risks to the responder on a poisoning or overdose call? What are the routes of entry into the body? And what are some things that EMS can do to prevent poisonings, especially in children? Remember that the poison or toxic substance may still be present and be a risk for you and your crew. So in addition, patients may potentially be combative due to the effects of the substance they have taken or come in contact with, which may alter their mental status. You have inhalation, ingestion, absorption, and injection as your routes. And then you have public education programs that emphasize the importance of securing hazardous and toxic substance from children. This might include you even helping distribute information. Maybe it's child safety locks or the Mr. Yuck stickers. I know I'm totally dating myself, but I remember those as a kid. So keeping that in mind, you might be part of that distribution process. Here's a critical thinking. A farmer calls 911 because one of his farm hands has tried to clean up spilled pesticide powder with his hands. On arrival, you find that the patient insists that he has brushed off all of the powder. He feels fine and does not need to go to the hospital. As he talks, he continues to make brushing motions at his jeans on which you can see the marks of a powdery residue. How do you manage the situation? First, you want to find out which pesticide is involved, what time it occurred, and what the interventions have been already. You want to check the pesticide label and attempt to help the patient understand the seriousness of the situation and that effects may be delayed.